Hey guys, my name is Nicholas Tolshe. I'm with Auburn University Family Nurse Practitioner Program. Today I'm going to do a video on the nurse practitioner role, on what it takes to be a nurse practitioner, transitioning from a nurse to a nurse practitioner. So let's get started. This picture just kind of shows the three main roles of a nurse practitioner. You have the practitioner role, the leader role, and the scientist role. And it just shows the transfer of knowledge to form the generic professional role that a nurse practitioner does. Start off with management of patient health illness status. This is one of the things that a nurse practitioner does. Differentiates between normal and abnormal results, diagnose and treat acute and chronic illnesses, guides to reduce risk factors among people, and assist patients in emergency, urgent, and complex circumstances. I like this meme. It says, nurse practitioners, the most interesting healthcare professionals in the world. Another role of the nurse practitioner is the nurse practitioner-patient relationships. So nurse practitioners, we create a relationship built on mutual trust and understanding. We validate and verify patients' information at all stages of treatment. We are empathetic to give emotional support and a sense of belonging for patients. We also maintain confidentiality and communication that show respect and dignity. The nurse practitioner, brain of a doctor, heart of a nurse. Another role is teaching and coaching. As a nurse practitioner, we access and provide for the changing needs of a patient, whether that's research or anything that can benefit or help patients in general. We eliminate perceived barriers and support patient education, coaches the patient through empathy and encouragement, monitors patient behavior and outcomes to assess changes. When, this is a sign when your oriented patient agrees to babysit your confused patient who won't leave you alone. I like that one. That's a good way to remember. One more role is the professional MP role, and just in general, we use scientific theories and evidence to perform tasks in healthcare facilities. We advocate for advanced nursing roles in modern healthcare. We participate in making policies and laws for affordable healthcare, and we analyze the relationship between socioeconomic factors and challenges in healthcare. One does not simply become a nurse practitioner, one earns becoming a nurse practitioner. All right, so also nurse practitioners, we manage healthcare delivery system. Provide integrated services for individual families and communities. We also ensure efficient and economic use of resources. We participate as a key member of creating collaborative health plans and policies, and we advocate for fair health policies that favor all the beneficiaries of healthcare. So a good way to remember all that is just grant NPs full practice authority. We're trained professionals too. It just says remove outdated barriers, let nurse practitioner work to their full potential. So next, we also evaluate and improve the quality of healthcare. Well, an example of that is we remain ethical in actions towards the patient. We can use personal strength and abilities to expound on the role of patients and colleagues, because most of us as nurse practitioners, we've been nursed. We know we've seen the patient side of it. Now it's just kind of transitioning to the nurse practitioner role, but we're still going to take some of our nursing policies with us. So ensure accountability with the highest standards of professionalism. Monitor the quality of individual practice for future improvements. Nurse practitioner, I'm sure you're just as smart, capable, and qualified as a real doctor. And that's sometimes true. Cultural competencies. We show respect to all persons regardless of social or economic background. Includes cultural preferences and treatment plans and options. develop cultural appropriate learning materials and modes of communication for patients, and we acknowledges cultural bias that may hinder treatment. So I'm a nurse practitioner. What is your superhero? And that's the end of my presentation. Just quick and short to the point. And thank you for watching, and I hope you learned something that nurse practitioners do and the role of our practice. Thank you.